Thank you, Michael, and good luck. Now, for years, my next guest suffered crippling back and neck pain and was taunted whenever she stepped out of the house, and all because of the size of her boobs. They were 36J. Well, she went from this there to 5 cup sizes smaller as one of the very first people here in the UK to try a brand new type of breast reduction that doesn't mean you have to go through major surgery. Well, Yasmin is here now, along with her doctor, Grupta, and our very own Dr. Hilary Jones. Very nice to see you.
You too.
And you even when you were quite young, you had big boobs.
Yes.
So did you find that boys would just talk to your boobs?
Absolutely.
Yeah.
And
it was like you were defined by the size of your breasts, basically.
I was the boobs, basically. I wasn't Yasmin. I was just the boobs.
Big boob girl.
Yes.
So a bit of a curse, really. Yeah.
Yeah. Absolutely.
And also, you were saying you had bad back pain as well.
Yeah. That was really bad. Sports out of the question. I could kind of get away with the pain, and then you had the social side, and it was just all together. It's every day. You couldn't get away with it. So, yeah, I mean, they're gone.
So you got really fed up with being kind of the butt of jokes all the time and just fed up with it, I suppose. Yes. And that's from when you were a teen?
Yes, from school, secondary school, and that's when it started. And obviously all the boys, and they all get a bit excited by it, and then it never went away. They always got excited by it.
So you wanted to do something, you wanted to have a reduction. So how did you find out about this? Because this is quite new, isn't it? This is a new procedure.
I was looking for the traditional kind, with all the scarring and, you know, major surgery, and I just found microlipo on the private clinic's website.
Right.
And no scarring.
This is you undergoing it all. There we go, and measuring to see what it's all about. And Dr. Grupta, why is this so different from traditional methods? I mean, clearly there hasn't been the scarring, as you've said, but is it just like liposuction? Is that what it's like?
Not exactly. There are a few differences. The first thing is far less traumatic than a surgical way of doing a breast reduction. Because it's done under local anaesthetic.
Right.
It's more like a walk-in, walk-out procedure, which is done in 2 to 3 hours. You're left with no scarring, no downtime. You could pretty much back to work and normal activities in 2 to 4 days' time, and you can still achieve a 50 to 60% reduction. There are obviously some limitations. Not everyone is suitable for it, but you can achieve a lot under local anaesthetic.
And are you just basically draining fat in the way that you do with liposuction? So it's not like breast tissue, it's fat?
No, for this technique, which is microlipo, I use these very fine instruments called microcannulas. Now, these are all less than 1 millimeter thick. So because of the nature and how they've been designed, they can actually remove a lot of breast tissue as well.
Oh, right. Okay.
And Yasmin's case is a very good example for that, because she's only 21. At such a young age, your breast will have a lot of breast tissue as well, along with the fat. And we managed to remove both of them.
Right. So how much was taken out of your boobs?
50%. And that's a litre out of each boob.
A litre?
Yes.
Of each one? Goodness me, girl.
I know.
How did you stay upright? At the risk of being one of those people that making jokes about it. But you feel better now. You feel more confident.
Absolutely.
And what about, immediately afterwards? I mean, Dr. Grupta was saying there you could get back to normal within a couple of days. Did you find that?
Yeah, I took the next day off work and then was back to work the day after that. Absolutely fine. I had this weird lump in the back of my neck before, where obviously I was hunched down.
Of course.
The next day, gone.
It's away.
Absolutely gone.
So, Hilary, this seems, an alternative, certainly, to traditional breast reductions. What do you think?
Well, I think I'm going to sound the word of caution here, because we've heard the upside of this procedure, but I think we also need to balance it. Dr. Grupta said already that not every woman is suitable for this procedure. This procedure is not really a breast reduction as much as a bust reduction. It doesn't touch much of the breast tissue. It's really taking out the fat surrounding the breast, which is a large part of the bust. Now, you can get problems such as fat necrosis, where fat cells die after the procedure, and lumpiness. Just as you can get when you liposculpt any part of the body, you can get an asymmetry at the end, and people need to be aware of this. You can also get the fat reappearing as the fat reforms. That's another possibility. But the main problem with this procedure, because it's not a particularly new procedure, it was looked at 10, 15 years ago, and not many aesthetic surgeons use it because of the problems, which were basically with large breasts, pendulous breasts, you get loose skin and you get sagging. There's no lift involved, as you would do with a standard breast reduction surgical procedure. So how long does it last? That would be my main question.
Yeah.
And how do you know that the candidates you have and do this procedure on are going to get the result they want long term?
So it's not, as you said, it isn't for everybody then?
Well, yeah, but there is a reasoning for all the points that Dr. Hillary has raised. It's not a procedure for those women who already got pendulous breasts, devoid of fat. We do remove significant amount of breast tissue with this, and where it stems from, how the technique originated, because it was a very successful technique to treat male gynecomastia, where you achieve complete flattening of the chest in men. With regards to risk of fat necrosis, that involves with any surgery when you're going into the breast. But because we're not using any external form of energy, that I mean laser or ultrasonic device to burn or melt the fat, so that risk is pretty much taken care of. And there are certain medical interventions that you want to consider. You do a pre-op scan, you want to do a post-op scan. There is always a risk with these procedures to put the fat back on, but I will not expect that to happen with Yasmin unless she puts on 15 kilos in weight.
You're not going to do that, are you?
Or it goes, or postmenopausally, because that's when the anatomy of the breast changes significantly. Most of the breast tissue gets converted into fat, so if you put on weight, they can still...
Do you know what? It's like everything else. For you, it's worked beautifully, and it's like everything else. If you're going to do this, you've got to make sure that you go to somebody who knows what they're doing. You know, you have to go to somebody who does.
Ask lots of questions, talk to patients who've been through the procedure, lots of patients, not just one, and make sure that the surgeon that you're going to is registered with the appropriate bodies and authorities.
Fantastic. Thank you all very much indeed. Fascinating. Thank you. Right after the break, Sophie Ellis-Bextor is going to be here, and actress Catherine Kelly is going to be telling me why after 5 drama-filled years, she's leaving Becky McDonald behind. See you in a couple of minutes.